I just want to start just by doing a visual exam. Seeing if I can identify anything on the skin, like any sort of bumps or changes in pigment. Any obvious swelling or anything I can see that would help and narrow down what we've got going on here. So you've been noticing this for about a week? Okay. Have you seen any kind of drainage or? No, okay. And are you able to sleep on your sides, or is it too much interference in terms of pain? Okay. I am seeing a little bit of some redness here. I'm seeing it on both lobes. Are those areas where you're feeling the bumps? Okay. Looking at the cartilage, I feel like I might see some raised skin, but I'll have to go back in with gloves on and do some palpation. Okay, really quickly. Just wanted to ask you just a couple of questions, okay? Okay. Have you been experiencing any kind of fever, chills, night sweats? Okay. Okay. And any dizziness, any fainting, confusion, nausea or vomiting? And how about any other kinds of GI upset? Okay. And has your hearing been impacted at all? No. All right. Okay, so I want you to just stick this right under your tongue, okay? It's going to need to go right towards the back of your mouth. Great, and then close your mouth, please. Okay. Temperature is normal range at 98.5. And if I can just see your wrist for just a moment. Thank you. Just going to take your pulse and excuse my looking over your shoulder. There's just a clock behind you. pulse is 84. That's good. So I'm just going to fit this blood pressure cuff just right around your arm. Okay. 128 over 82. This one is never very good at deflating. And then while I have my stethoscope out, I'm just going to listen to your chest, okay? So. Can I have you take a deep breath in and out for me? Good. And again. Deep breath in and out. Okay. Again. And again. Okay. Breath sounds are nice and normal. Your chest sounds clear. I'm not hearing anything concerning there. Alright, and I just want to take a quick look at your eyes. Just do your best to keep them open, okay? Just making sure I don't see any kind of evidence of any sort of drainage or irritation. Making sure your sclera are a nice clear white. A little bit of redness is okay. Focus right here between my eyebrows. Right. Good. I'm going to take a peek inside of your ears just to rule out any internal involvement. I don't think we'll find anything, but I think it's important to cover all of our bases. So, going to feel me pulling your hair back. Good. Okay. Well, I am seeing a fair bit of wax inside this ear. Not seeing any kind of redness or swelling, which is good. This side. So again, you'll feel me pulling your ear back. Yeah, this ear has a pretty good amount of wax inside of it as well. Doesn't look irritated or inflamed, but it's pretty busy inside here. So, okay, I would like to do a brief ear cleaning. It's not going to be in depth. Just to remove some of the cerumen that I'm seeing inside of your ears. I just don't want there to be any kind of cross-contamination. So just going to use this earwax removal spray. It's going to help loosen some things up. And then I'm just going to go in there with a little brush to kind of just pull anything out. And it's a really gentle method. I don't think we need to go in there and pick anything or do any kind of flushing. But just to, first of all, get a clean canvas, so to speak, in terms of examining the external ear, and also to rule out whether there's any kind of interior ear involvement or if that's even the culprit for what you're experiencing. So we're going to start here, and then I'm going to re-examine your ears and see if I can pinpoint any kind of involvement interiorly and exteriorly, and then we'll move on to your exterior ears, okay? Okay, so let's just fits inside the ear. Make sure it's open. There we go. It gets a little stuck. All right. Okay. I almost dropped the lid. All right. So, ear back again. Much better. Your ear is nice and clear. Not seeing any fluid or I think we can roll that out. Okay. Are your ears tender to the touch at all? Okay. I just want to very quickly, using my hands, feel if there is any kind of elevated temperature to the ears, okay? So I'm not going to squeeze, I'm just going to very, very, very lightly touch. So. Okay. They seem to be the same temperature as the rest of you. I'm going to use a little bit of some mineral oil to palpate the ear, just because I want to make sure it's comfortable for you, okay? Or at least as comfortable as I can. So, I'm going to start on the side. I am feeling in the cartilage there's 2 nodules up here. Got one over here. On the lobe there. Gonna feel your tragus. Okay. And some of these cartilage folds. So it's really just the outer region here. I am feeling a nodule here in the earlobe. going to take these gloves off with them now because they're very oily. Okay. So I'm gonna go and just looking with a magnifying glass, okay? And has a little light. It's just gonna help me see if I can actually detect any sort of redness or bumps I just wasn't able to see with my naked eye. Okay, yeah. They are faint, but they are there. The ones in your earlobe here are a bit easier to see. Take a look. Forgive my stool, it's a bit on the creakier side. It's actually quite old. Okay. So I do see some pinkish skin over the bump that's in the cartilage. This side's like the other where the earlobe is the easiest one to see. Okay. So I think what we're seeing is consistent with something called a spacious cyst, and in this case you have 5 of them. And these are just caused by oil glands or even hair follicles becoming blocked. And they are pretty common in the ears just because our ears do get pretty oily, and these little nooks and crannies can kind of trap that oil in place. And then also, we get hair products, shampoo, conditioner, gels, hairspray, often on our ears. So it's actually pretty common. I would like to start by trying to treat this just using warm compresses. If in fact the warm compresses after a week just aren't making a difference, then we can try a needle aspiration or an incision and drainage. But that's only if they become more severe, more painful. But I'm pretty sure, judging by the size, that warm compresses should do the trick. So we can start this in the clinic. I have little hot packs here that we can activate, and then compresses like this work better with moisture, so we will use some paper towels and get them a little bit damp and then hold them on your ears. When you're at home, you can use a warm washcloth, but for sanitary purposes in clinic, we're going to use disposable items. So just grab couple of towels and another hot pack. Alright, that should do. Pop on another pair of gloves. This hand got a little bit wet, which of course makes this challenging. How's the temperature? Is that okay? Okay. Let me know if it gets too warm because I can definitely add an additional towel. Change my hand position here. Goal here with these warm compresses is to try and encourage the nodules to drain on their own. I don't think that that's going to happen this time, but it may bring things closer to the surface. After a few of these, you might notice some whiteheads forming. Do not pop them, please. I know it can be very tempting, but we don't want to risk spreading bacteria and even possibly triggering an abscess. So, if in fact whiteheads do form, will be at least one or two compresses away from them draining. Actually, I'm gonna adjust my, if little. You're totally fine. Okay. So, just going to take another look just to see if there's any kind of change. Not seeing any changes, but that's okay. So I'm just going to take a quick note, okay? Okay. So, in terms of home care, okay, I want you to do your best to keep your ears as clean as possible, just using mild soap and some water. So you don't need to use any kind of stronger products like alcohol or Bactine or anything like that. Just like a gentle fragrance-free soap that you can just pick up at the drugstore. Alright? Okay. Those warm compresses we did, you can do those just with a damp washcloth, or if you want to get heat packs, they do have them in the first aid section of most grocery stores, or you can find them at the pharmacy. I'm going to have you do those 3 to 5 times a day to help and encourage anything inside of those bumps, those cysts, to come to the surface and hopefully form a little whitehead to then drain. However, if after 5 days you're not seeing any changes and nothing is coming up, then I want you to come back in and we will reassess and decide whether it is necessary to do something more invasive, if you need to go on an antibiotic, or if we need to involve a specialist. But I don't want to jump ahead just yet, because oftentimes these things clear up just with simple methods. That being said, if you start seeing a lot of redness, if the ears start becoming painful or hot to touch, you get any fevers, chills, night sweats, then I want you to come back in right away or go straight to the emergency room. If these things happen after hours, we do have an answering service who can page the physician on call, and they'll give you instructions as soon as they call you back. And it's usually within about 30 minutes. Do you have any questions for me? Okay. I'm going to give you a call in about 48 hours to check in and see how you're doing, okay? Okay. We'll get this resolved. You take care.